All right, can you guys see my screen?
Yes.
Yes.
All right, perfect. So I'm just gonna ask everybody to mute their microphones. It should be on the bottom left. And then when we get to the question and answer portion, you could unmute if you have any questions, or you could type in your question in the chat box, and then Cassandra or I will read it off and answer the questions if you don't want to unmute yourself. So we'll go ahead and get started. So for those of you that don't know me, I'm Tanya Velez, and I'm the founder of Velez Family Health. We do have some new folks joining us in January, which is very exciting. We were so incredibly busy, especially this year with COVID and whatnot, that we weren't taking new patients for a long time. So I'm excited to get some new patients and new members to the family. So this is our little family. It's actually gotten smaller, unfortunately, this year, but it's been for the better. So Lydia and Cassandra are the two that you typically speak to on the phone. Those of you that have called or visited the office have probably met them both. Lydia is actually my mom, and she's been amazing to add to the team. She has a lot of experience in the healthcare field, front and back office. So she's helped me out with a lot of things. And for those of you who have been with me for a long time, you definitely know Cassandra. It was just me and her, and she's here. But it was just me and her from the beginning. So back in 2015, March 17th, St. Patty's Day, we started off Velez Family Health 2 days a week with one room, and we've grown from there to what we are today. So she's been with me since the beginning. She's also our health coach for the lifestyle programs that we were running. We took a little pause this year just because, trying to figure out all this virtual all the virtual visits and whatnot, but we plan on restarting that again early next year. And now she's even better trained to be a health coach. She should be finishing up her schooling for nutrition and personal training soon. So congrats to her. The third person on here you probably will never meet. She is behind the scenes, and like all of us, she wears many, many hats. But I call her my money person. So she keeps track of everything. Also does our HR and payroll and all that kind of stuff. So she has been working long hours to keep us in business this year. So I truly appreciate her. So today we're just going to go through a little bit about my journey, why I started the practice, and kind of how we ended up where we are. And of course, we'll talk about what is direct primary care and how it's different from the traditional conventional system that we're all used to. We'll go through some of the common questions that we've been asked, and then also go through how to set up the enrollment. So a little bit about me. I apparently, my parents tell me that I apparently was saying that I was going to be a doctor since I was about 2 years old and could speak. I'm not completely sure how I knew that, but the only thing that I could think of is that I was a sick kid and was in and out of doctor's offices and hospitals for the first few years of my life. So I was introduced to the field at an early age, and felt, that I wanted to be one of those people that helped others. I went to school at several different schools. I started off at Valencia. That was Valencia Community College back then. It is now Valencia College. Then went over to UCF, and then also did a little bit of time over at Seminole College. That's where I did my EMT certificate. So I was an EMT for a while down in Miami in a really busy ER. So I definitely got a lot of experience before even going to medical school. But I knew that this was what I wanted to do. I knew I wanted to help people. I was fascinated by science my entire life, and I was the weird kid that would rather read like National Geographic and watch the Discovery Channel rather than watch cartoons and other things. I watched those too, but I liked all the science stuff. Um, I've done a lot of international medicine programs, done a lot of work in underserved communities, and I've seen the disparities in the healthcare system, especially here, but also in other countries. So I've definitely seen the disparities and the inequities, and our my goal was to somehow try to help with that, and somehow try to kind of even out the playing field and provide the best care possible for people in their most vulnerable situation. Um, so back in 2012 is when I graduated from residency. I went to Florida Hospital, or what's now Advent Health, family medicine residency. Um, After that, I was kind of bummed. Residency was kind of a wake up call as to how the healthcare system really worked, and kind of the business side of the healthcare system, which was good and bad. But I didn't want to work for a corporate entity. I didn't want to get stuck with, some of these contracts that some of my colleagues were getting. So I became afloat and did some locum tenens work for a while, which was a great experience to kind of figure out what I did and did not want in my practice. I never thought about starting my practice as soon as I did, but I wasn't happy with the way that most practices were practicing. Let's put it that way. Um, I did a fellowship in integrative medicine through University of Arizona. I started that just before I started my practice, so I kind of the first couple of years was a little rough, but it definitely helped as far as the part of doctoring that medical school doesn't necessarily teach you, and that's the part of nutrition and lifestyle and supplements and all of these other what they call alternative medicine, that's not really alternative, it's just not pharmaceuticals, um, and that kind of helped to solidify that I was actually doing what I wanted to do. It came to a point where I actually was considering quitting medicine, until a good friend of mine actually convinced me. She's the one that convinced me to start the practice and to do the integrative medicine fellowship. So 2015, we started our practice. This is one of my favorite quotes. I've used this quote probably in every presentation I've ever done. But he that has health has hope, and he that has hope has everything. Our health truly is everything. Our health determines our quality of life. It determines if we could work. It determines if we can live independently, if we could play with our children, if we could play with our grandchildren. We're going to be around for all of those things. So I went into medicine because I believe that healthcare is a human right, and I believe that healthcare should be affordable and accessible to everyone. So let's talk a bit about our current healthcare system in the United States. So this is from data from 2018, or up to 2018. And these are comparing the US to 10 other wealthy nations, so the more developed nations. And that line up top, that is the US. So the US spends the most in healthcare compared to any other wealthy nation in the country, or excuse me, in the world. Oops, there it is. And this graph is showing our life expectancy. That line on the bottom, that is the US. So although we spend the most of any other country in the world, or of the wealthy nations in the world, let's put it that way, we also have the lowest life expectancy compared to these countries. Compared to these other countries, we also have the most adults with multiple chronic conditions. So chronic conditions would be things like diabetes, hypertension, high cholesterol, et cetera, et cetera. Compared to these countries, we're also the highest number of hospitalizations from preventable causes and the highest rate of avoidable deaths. So preventable causes meaning, again, chronic conditions. So things like high blood pressure, diabetes, et cetera, et cetera. These are more diseases of lifestyle. So why is it that we spend the most money than any other wealthy nation, but we have probably some of the worst outcomes? And it's basically how our system is set up. So we'll talk a little bit about how our system is set up, but I wanted to kind of go through some of the things that you may have experienced due to our system. So on the patient side, typically there's long waits. I know that even for my practice, when we were at our busiest and had a physician assistant with us, our wait time for new patient appointments at one point got to be about 6 months out. That's just kind of ridiculous. And I mean, even as my practice, I didn't like that. But even if you've ever tried to visit a specialist office, even then, I mean, depending on the type of specialty, you're waiting a good anywhere between 2 to 6 months just to try to get an appointment. We know that there's high cost involved in healthcare. There are surprise bills, which I think probably all of us have experienced, including myself. And unfortunately, the last one, bad care, is not necessarily the care itself, so meaning the treatment that you received, but because the way their system is set up, most healthcare providers are burned out. They're tired, and unfortunately, that reflects on the way that they practice and the way that they communicate and relate with their patients. On the other side of that, so physicians, because our system is set up to be volume based rather than time based, it leads to burnout, you know, especially with most practices being owned by hospitals or corporations. You know, these doctors are being told how many patients they have to see in a day. And that definitely leads to burnout. Most of our time is not spent seeing patients. Most of our time is spent on paperwork and, you know, monotonous things that have nothing to do with how I take care of the patient. Insurances dictate the treatment. So, you know, how many times have I tried to order something that the insurance says, no, you can't order that now. You have to do all of these other things first, which is just time consuming and expensive. And there's low compliance as far as compliance of the treatment plan with the patient. Again, not because of anything that the patient's really doing wrong, it's because of the way the system is set up. If we don't have the time to explain the reasons why or educate the patient, then how do we expect the other side, the patient, to actually follow through with what we're recommending? So this is how conventional medicine works. So you have your doctor or your provider, then your administrator, then your insurance company, then the regulators, and then comes the patient. So you have to go, through all these things to get to, and never is it just doctor to patient. So unfortunately, I've said it multiple times that our healthcare system is broken. I was watching a great TED Talk the other day, and he said the system is not broken. It's actually working exactly how it was designed to work for all of those things in the middle, all those middlemen. So the healthcare industry is a $3.3 trillion industry. And the healthcare industry alone in 2016 spent $509 million in lobbying Congress. That's just in 1 year, $509 million lobbying Congress. That is more than any other industry in the country. So unfortunately, there's a lot of middlemen that are the ones that are making money off of our sickness. And they're the ones that set the regulations. They're the ones that set the, the large amounts of paperwork that we have to do, the click boxes, the data that we have to submit. And unfortunately, most of them actually know nothing about medicine. For every 1 hour that I spend seeing patients, I spend about an extra 2 hours doing paperwork, checking off boxes, submitting data. And this is not just me, this is my staff as well. So if you think about an 8-hour day of seeing patients, there's about 16 hours of work that we have to do behind the scenes just to keep up. So the difference is in direct primary care, the doctor has a direct relationship with the member. There's no middleman, there's no third party. There's just the two making decisions together and having the time to educate the member on the different treatment plans so that they have a say and they have, we increase compliance by doing that as well. And we decrease costs because now we've taken out all these. So I don't expect you to read this whatsoever. The whole point of this graph is this is what it looks like in an insurance-based system. So the red is insurance administration. The yellow is all the steps the patient has to take. The blue steps are the provider. So as you can see, there's a lot of red on there. So the current system that we're in now is what we call a fee-for-service system, which means you pay a fee for each service that you receive. So that would be, for instance, an office visit. If that office visit you had an EKG done, if that office visit you had a urinalysis done, each one of those is a separate code and each one is billed out to the insurance as a separate fee or directly to the patient if they don't have insurance. So we're actually paid to do things to the patient rather than actually care for the patient. So let's talk a little bit about how insurance companies work and how they determine how much they will pay for each individual service, and in turn, how much you will pay for each individual service. The majority of people now have a deductible. So I don't know, what each one of you have, but the majority of people have a deductible. I know when I had insurance, mine was about $6,000. So that means for everything that I needed to have done, there was a fee associated with it, or what we call an allowable. So I want you to think about a retail store that always has a sale. I could think of a few department stores, I won't say the names, but they always have a sale. So how could they always have a sale and still make money? So the majority of times what they do is they actually mark up the price a little bit, and then they give you a discount on top of that marked up price so that it looks like you're saving money. So this is actually exactly how insurance companies work. So they will go to the hospitals, the big groups, the specialists, they have more negotiating power. So they always get paid more than us little people in primary care, especially in solo practice. But basically they have to report back to either the employer or the government or whatever corporation they're representing and show that there's been a savings. So, the hospitals, imaging companies, labs, etc., they mark up their prices. They negotiate a rate with the insurance, which is what the allowable or the contracted rate is. And then the insurance could go back to whoever they have to report to and say, look, we saved you all of this money. That surgery was supposed to be $100,000 and we only paid $60,000. So we saved you $40,000. What they're not saying is what is the true cost of that service. So what is direct primary care? So direct primary care is affordable, accessible, comprehensive primary care. Most of the care is provided by a flat monthly fee rather than per visit or per service. You have a direct relationship with your doctor. There's no third parties. And because of this, because we are not volume-based anymore, then we could truly focus on wellness rather than sick care. So in the fee-for-service system, you stay in business by charging for each individual service. So technically, the sicker the person is, then the more money potentially you can make. And it's a horrible way to explain it, but unfortunately is the truth. Insurances don't cover, or prior to COVID, they did not cover televideo visits in Florida unless they were a contracted company. They didn't cover phone calls, they didn't cover emails and all these things. So people were forced to come into the office for everything. So with direct primary care, we could truly focus on wellness. We could build that relationship, and we're not lugging you into the office for every single thing. So it's much more efficient. There's actually studies out for direct primary care. If anybody ever wants to see it, I could send you a few. But there's better health outcomes from direct primary care for all the reasons that I just mentioned. Definitely lower cost. There's an improved patient experience. You could get timely care. So in direct primary care practices, for anything acute or urgent, you will be seen same day or next day. So that way you don't have to seek out urgent cares and ERs if the doctor is available to take care of you right away. There's a focus on wellness, and again, there's that personal relationship with your doctor. So what's included in the membership? I keep saying a personal relationship with your doctor. The visits are unrushed. They are going to be 30 to 60-minute visits. We are probably one of the very, very rare insurance-based practices that actually give more than 15 minutes to a patient. And I have fought this since the beginning. Unfortunately, on the business side of things, that has not been sustainable, which is one of the many reasons why we're switching to direct primary care. But you deserve more time. You deserve to be heard, and you deserve time to be able to have that discussion. So again, focus on lifestyle wellness, same day or next day visits, in-person and televideo, phone, text, email. Again, there isn't this inefficient system where you have to be seen face to face for every single little thing. A lot of things we could just do very quickly and efficiently. Anything done in the office, EKGs, urine, we have strep and flu in stock, any of those type of things. We'll be coordinating care with specialists in hospitals. Unfortunately, under the fee-for-service system, there's no time, and we're all kind of running around, and sometimes that follow-up with specialists is just not there. So we're going to have more time to be able to coordinate these things. Also, there's going to be less referrals to specialists. I know that when we first started the practice and I had very few patients, I had a lot more time to look things up and really get thorough with things, and therefore didn't really need to spend to a specialist unless it was an exceptional case that I couldn't handle. So I'm hoping to be able to get get back to that. We're also going to, we already have discounted labs, and I'll show you some examples of that, but about 90% less than what the typical lab prices are through insurance. We've been networking with imaging companies for discounted rates as well. I'm working on getting my license to be able to dispense generic medications, because again, as the true price of these things are actually really cheap. There's a markup at the pharmacies and in other places. So our plan is to try to get as many things wholesale as possible. And it'll be wholesale plus 10%. The 10% is only just to cover our costs of the bottles, the labels, and all those types of things. But we could pass on those savings to the member. And like I mentioned before, we have lifestyle programs that we're going to be starting back up again. And so our members will have significant discounts on any of those programs. But the best part of it, I think, as a patient myself, is the no surprise bills and very transparent upfront pricing. I'm going to run through an asthma case and then the common questions. Does anybody have a question right now just relating to what I've already covered? Okay, I'm going to take that as a no. Is everybody still there?
Yes.
Okay. I can't see your faces when it's in presentation mode, so I'm like, I hope everybody's still there. Okay. So we'll run through an asthma case real quick. So this person, well, let's say it's me. I have asthma. I've been through this. So we won't say my age. A female patient. It's February. It's allergy season. Allergies are horrendous, and she has a really bad asthma flare, or so she thinks. So she's debating whether to go to urgent care, the ER, or call her doctor. She made the smart choice and called her doctor, and they got her in the same day. So the numbers on this case is going to be pretty similar to actually what her pricing is right now, which is pretty low compared to like urgent cares and ERs, but we'll compare it to direct primary care. So this is probably much lower than most offices, but we'll go with what I know here. So she comes to the office visit, so that alone is going to have a charge, right? So that's $120. She's an established patient. The doctor examined her and she was wheezing and her lungs sounded horrible. So doctor decided she should have a breathing treatment in the office. All right, that's another $40. Her asthma is really bad. She's wheezing all over the place. She's short of breath. All right, the doctor thinks she needs a steroid injection. And when she listens to her lungs, she's like, I don't know. It kind of sounds like you might have a pneumonia or something like that. So I think we should give you an antibiotic injection as well. Plus, we're going to send you for a chest x-ray and prescribe some things for home. So just with the office visit alone, and again, this is estimated prices at my current office. Just with the office visit alone and the breathing treatment and the injections, you're at about $330. If this person would have gone to an urgent care, the office visit by itself would have been about $300, but before any of the treatments. So she got sent for a chest x-ray. She paid as a cash pay client, so they charged her $60 for the chest x-ray. She got a few prescriptions. She's got an Augmentin, which is an antibiotic. She got some steroids. And you know what? She didn't have a nebulizer machine at home, the breathing machine. So she's got to pick one of those up. She's got to pick up the medication for that, as well as an inhaler, because we got to keep this asthma under control. So at this point, the total cost, she's up to about $535, which again, considering the ER costs and the urgent care costs, that's pretty good. But I don't know about you, but that's a that's a tough, that's some paychecks right there, and part of the rent. So still it's $535 out of pocket. If she would have gone to the ER, probably would have been way over 2,500. If she would have gone to an urgent care, depending on which urgent care, it would have definitely been over 900, if not over 1,000 for some of them. So let's say she went to a direct primary care clinic, and this direct primary care clinic also dispensed medications, and had a contract with the imaging company for discounted chest X-rays. So she called her direct primary care doc up, and she got brought into the office immediately. She didn't have to pay anything for that office visit. That's included in her membership. She didn't pay anything for that breathing treatment. That's included in her membership. The injections that she got in the office, she just paid whatever the wholesale price is for those medications. So about $5 each. So her subtotal for that visit, she's about $10. But she still has to do the chest x-ray. She still needs to get the medications. But this doctor, again, is able to dispense generic medications at wholesale prices. So these are the prices that she paid. So at the end of this, the total cost was $114. Now this is kind of an extreme case. You know, this patient needed a lot of different services. The majority of the time, hopefully, if we keep you well, that's the whole part of well care. You don't necessarily need all of these extraneous things unless it's, you know, a serious illness. But let's say for her, this, you know, she was really sick. So just in office visits, again, not even considering the ER, she saved about $420. Again, if she would have gone to the ER, she would, you know, compared to that, then she's saving over $2,000, compared to the urgent care, saving over $700. So the costs add up real quick. And again, this is just using our office prices, which are the current ones, and probably way lower than other prices from what I've seen, at least. And just a few more comparisons, you know, a lot of the things that we could do in office, I mentioned EKGs, you know, skin biopsies, skin tag removals. You know, these are all pretty simple procedures. I love doing procedures, and I don't do enough of them right now because, again, a lot of times insurances don't cover it, and then patients don't want to pay for it, and et cetera, et cetera. So this kind of frees you up to get done whatever it is that needs to be done, and not have to worry about, well, how much is this going to cost me? As far as labs, the majority of our labs are anywhere between $3 to $6 each. We could do a full annual physical panel, including vitamin D and B12, for about $50 or less. The MRI is a good example. My doctor sent me to do an MRI a few years back. And again, I had a $6,000 deductible. So they were going to charge me about $500 for that MRI. So I called around and I said, I don't have insurance. What would it cost me? I ended up getting it for $250, just direct pay. It didn't go towards my deductible, but obviously I saved $250. So I went with that. And lastly, direct primary care decreases the likelihood that you will need to go to an ER. That alone will pay for your entire year membership if you could avoid an ER visit. Obviously, there's a time and place. You know, there's certain situations where, yes, you will need to go to the emergency room. If you're having a heart attack, you need to go to ER. But for simple things, you know, this patient that we talked about before, she had pneumonia, she had asthma. You know, that's something that we could totally take care of in the office, and there's just no need for such a huge bill from the hospital. So I'm going to ask you guys, so this is an example of a PSA, a prostate specific antigen test for prostate cancer. So this patient asked his doctor to order a PSA test, but Medicare said he wasn't due for one. So if something's not going to be covered by Medicare, they have to do this notice and tell the patient an estimated cost. So the PSA was going to cost him $201. That's just for the one test. So I'm going to let you guys guess. How much do you think our price is for a PSA? Anybody?
I won't say because I do know the price.
$50.
Oh, 25
What did you
bucks.
say? 25, 50?
20, 25?
Okay, okay. $5.
How much?
$5.
Oh my God, I was closer. See, the closer was
$5. So the what they call the allowable rate for Medicare was going to be $201, which is nonsense. There's just no reason for that at all. So our contracted price for PSA, and this is accurate, I looked it up again just to make sure, $5. And since I mentioned Medicare, a little side note here. Medicare is an interesting beast. It is government, so we have to be a little bit careful with Medicare and how I do things. So instead of having to walk over eggshells, I decided to opt out of Medicare. What that means is, as a provider, typically as my practice is credentialed with an insurance. With Medicare, it's the individual. So anywhere that I go, if I am credentialed with Medicare, I cannot charge that patient anything that's not run through Medicare. So I am opting out of Medicare as of December 31st. What that means is that we cannot file any claims with Medicare, which that's fine because we're not filing any claims with any insurance company anyways. But also the patient cannot file any claims for any services that have been rendered by my practice or by me. So meaning if you saw me in the office and you try to submit that to the insurance, that's considered to be Medicare fraud. So there'll be just an additional waiver just saying, if you have Medicare, you're not going to try to file to the insurance for a visit. All right, so I'll run through the common questions and then I'll set you guys loose with questions. So one of the very, very common ones is, I am healthy and I rarely see a doctor. Should I join? And the answer is yes. Again, the goal of direct primary care is to keep people well, not to wait until there's an issue and then try to fix the issue. So preventive care can keep you healthy. Also, unexpected things happen, illnesses happen, injuries happen. And again, it could avoid you very costly bills if you already have that relationship with your doctor that you could just call up or come in and see and avoid the urgent care or the ER. The other question is, do I still need insurance or what's called a cost sharing plan? I'll explain a little bit about that in a second. And the answer is yes. So insurance is supposed to be for unplanned costly events. So a hospital visit, potentially a specialist visit, a surgery, these things that they could definitely run up very costly bills. So we do still recommend that you have some kind of coverage. Now, depending on each individual case, for many people, you could potentially save money by getting a plan that maybe has a little higher deductible, but a lower monthly premium, because we will have these amazing prices as far as labs, some discounted rates on imaging. Once we get our drug approval, then we'll have some generic meds. So you don't necessarily, 80% of people don't actually meet their deductible. So you can actually save money by paying direct and then keeping that insurance for those unplanned things. Now, everybody's situation is different. Everybody, potentially has different medical issues and whatnot you have to take into account. But I'm just speaking for the majority of people. The other question is, can I send you to specialist? And yes, I can. I'm still a doctor. I can still refer. like I explained before, because we have more time and because we will be focusing more on well care, the need for specialists is going to decrease. Now, in the event that we do need to send you to a specialist, then we will make every effort to coordinate that care. And I will attempt, only because sometimes I don't get a call back, but I will attempt to personally discuss your case with the specialist before you go to that visit, so that when you do go, the specialist knows exactly what they need to do, and why you're going there. A lot of times you end up getting a lot of runaround by seeing multiple different people. So we want to make sure we coordinate all that care. Let's see. Do I have to get lab tests or medications through our office? No, it's there. If you would like to take advantage of it, you're under no obligation to do so. If you do have insurance that covers those things and you'd like to use your insurance for those things, by all means, you have the option. One other thing about specialists: the only time that it may become an issue is for people that have an HMO insurance. HMO insurances typically require a prior authorization from the insurance company in order for you to see a specialist. Because I will no longer be in network with any of these insurance companies, my practice is not allowed to contact the insurance company for that prior authorization. So just keep that in mind. If you do have an HMO, I always recommend, if possible, to go with a PPO. You have more flexibility and usually a bigger network to access by doing so anyways. And the last one, I kind of answered this already. So why should I pay for DBC membership when I have good insurance already? Good insurance usually don't go together, but again, 80% of people never reach the deductible, and coverage is not the same as care. And I think if you've visited other practices that are incredibly busy, that you get, if you're lucky, 5 minutes with the doctor, you'll notice that very quickly. Just because the insurance covered that visit doesn't mean that you got care. So that's going to be a huge difference. Are there any alternatives to insurance? Yes, there is. There are what we call health sharing plans that are not insurance. They are not regulated by the insurance regulators, and they do not use the same terminology as insurance either. But they're a great way to cover any unexpected things that come up. They just function a little bit differently than insurance. So basically, you're putting money into a pot every month, and out of that pot of money, all of the members of this health sharing ministry, they will pay any qualified medical expenses above a certain amount out of this pot of money. Some of the very popular ones that work really well with direct primary care are those three that I mentioned there, which is Zion, Sedera, and Christian Ministries. I know for sure that Zion and Sedera will offer a reduction in your monthly, it's not called a premium, it's called a voluntary donation. But they actually give you a discounted rate if you are part of a direct primary care practice. And the reason is they know that they're not going to have to pay out as many claims because you're going to be getting great care from your direct primary care. Those links I'll be adding to our website soon for Zion and Sedera. They were going to send us some specialized links so that if you sign up through those links, it'll automatically tell them that you're part of a DPC practice and give you that different rate. So will you provide me a claim so that I could file out of network for a visit? So this is a tough one, and I know that some people are not going to like this answer. The answer is no. Because we are doing it by a monthly membership and we will no longer be fee for service, What the insurance companies want on a claim are going to be very specific codes. We call them CPT and ICD-10 codes. And we have to put the fee for each one of these codes. Because it's a membership and because most of the things are covered under your membership, there is not a specific fee for each one of these things. Also, my documentation will no longer support the requirements for insurance billing. My documentation currently for insurances, it takes a long time. And I have to click and write a bunch of fluff that has nothing to do with anything. And I'm always behind on charting because of this. Because this is now a relationship between the doctor and the member, my documentations, it's going to be just that, something that the patient could read, something that I could read, and not something that's going to support any codes or bills or anything like that. Also, because we're charging a membership fee, it would actually be fraud if we put a specific fee for each individual code, because that's not the way that you're paying. Let's see, can I use my HSA, FSA, or HRA to pay for the monthly memberships? Some of you might actually know what these things stand for because you might have one of these plans. This is typically through your employer or through a qualified plan that'll allow you to have this. And this all has to do with IRS and their weird wording and whatnot. So HRA, or is it Health Reimbursement Account, or FSA, Flexible Spending Account? Yes, absolutely. You could pay your monthly membership fees with those. The HSA, I put maybe. There's some weird IRS wording that makes that a tricky one. So the best answer is going to be just to ask your plan administrator or your accountant and just ask them, can I pay for my monthly membership fees with this? And they'll be able to tell you. You could use any of these plans for anything additional, such as labs, imaging, medication. You could definitely use for all of those things, even if it's through us. And probably the most important question that everybody has asked is, how much is it going to cost? So these are going to be our prices. I decided to start our pediatric population at the age of 10, only because it's going to be difficult to stock all of the vaccines. And then it goes up based on age. And then we do have an enrollment fee, which will be completely waived for everybody until December 31st. And that's listed there below. So it'll be $100 for the first individual, and then $50 each additional person on the same account, with a $200 family max. So if you have, let's say, 2 adults and 5 kids, the enrollment fee will max out at $200. But again, those are all waived until December 31st. And I am almost done working with the software company for the official enrollment link. That will be going out in the next few days. Right now, what we have is an interest list where you can put in all of your information. We will be sending out that official enrollment link to all of the people that sign up on the interest list first. Because of the nature of this program, because we want to make sure we have enough time for everybody, we will be capping at 600 patients and then starting a waiting list after that. So if you are interested and you would like to join after this meeting, then definitely put your name on the list. And then as soon as that enrollment link is available, I'll be sending that out within the next few days. So thank you everybody for joining us. I truly appreciate all of your support. I know this year has been quite the whirlwind, but we're really hoping that, by making this transition, we could really provide better quality care for everybody. and actually get back to the medicine that we love and enjoy, and not this crazy rat race that we're in right now. If you have any other questions, please let us know. You could go to our website, you could call us, you could text us, you could email us, and we'll try to get back to you with those answers.
Thank you so much, Dr. Velez. Appreciate it.
Thank you.
Yeah, no problem. Take care. Have a good night, everybody.
Have a good
Have a
night.
good night.
Good night.
Thank you.
Sandra.
Good night.